right, good evening. This is our 5 p.m.-ish update on the coronavirus here in Kentucky. First, let's remember we are all Team Kentucky. This is all of us together, accepting the disruption that is occurring in our lives to come together and to do what it takes to defeat this coronavirus. We will do that. We will get through this. We will come out on the other side. And we will be okay. But it takes everybody being a good teammate. It takes everybody following the guidance that we're giving, especially of reducing contacts and engaging in social distancing, for us to truly make sure that what we are doing is working. As you all know, we are taking aggressive action, and if you could show the charts on contacts. And this is why we're doing it. We're going to continue to show people why we're doing it. Our goal is to make sure that we do not cause a shock or a spike to our healthcare system, so that everybody who is really sick and needs our help can get that help, and that we can hopefully reduce the number of cases that we see, so that everybody who does fall ill can get the help they need. And we've all seen the news that the first Harrison County patient has had 2 negative tests back. She is out of the hospital. That is really exciting, and it ought to truly encourage us. Also ought to tell us that we have to react with compassion when someone does have the coronavirus, and once they're through it and out of it, we ought to be treating them the same as any other individual out there. Again, all of us together can do what it takes, and we will get to the other side. So now that we have about 3 different labs up and running, again, not at the capacity we want to see. We want to see everybody who wants a test to be able to get a test, but the numbers are going to get a little different in that we will have some numbers come in that we haven't been able to confirm yet, and you'll see that in a minute. So of our state lab, today we had 29 cases that we looked at, and we have 1 positive case out of that. We have 27 negative cases, and we have 1 inconclusive case. We're still following up with the 1 positive case. I can't give you a county on that now, but I will be able to do so tomorrow. We also had 8 cases that we got from the U of L lab. 3 of those are positive. We can't tell you right now whether those are 3 entirely new cases or just 1 additional case above those that we had from that lab. So we're going to have to update those numbers when we have that information. And then we have 1 positive case that came from LabCorp in Montgomery County. We have Allison Napier here from their local health department. We know that they are ready to address this coronavirus, which is going to be found everywhere. Remember, we expect more positive cases as we go. This was never going to be limited to just 3 counties. All of our people out there, all of our health professionals are ready for it. And I know Montgomery County has already started taking the steps even before we learned of this positive test. They have already canceled school, and they're already taking the necessary steps to get there. Like in every one of these updates, we're going to go through the different steps that we are taking, provide a little bit of new information. We won't this afternoon have a lot of new guidance. We will have more as we move, especially through next week. So to date, we have declared a state of emergency here in Kentucky to have the funding and tools we need to address the coronavirus. We activated the Emergency Management Operations Center and the State Health Operations Center. We announced Kentucky's COVID-19 hotline, 1-800-722-5725. We have an infographic up on our website, if you'll scroll down to it a little bit, please. The When to Seek Care infographic. There we go. And that's very important in conjunction with the hotline. If you are well but nervous, do not go to a healthcare facility. We don't want to flood them. Call the hotline. If you are sick but otherwise would not have sought care, think allergies, colds, do not go to a healthcare facility. We don't want to flood them. Call the hotline. But if you are truly sick, would have sought care, or you are injured, please get the help you need. If we can follow these guidelines, what it'll make sure is that person who is truly sick can get the help they need. It's about being a good neighbor and making sure that we use our resources wisely and appropriately. Kentucky, I think you're doing a great job of this, but we got to keep it up. We got to stay disciplined about it. We got to make sure our fear doesn't overtake us and respond calmly and rationally to what we face. We announced Kentucky's COVID-19 informational website. I can't stress enough that this is the number one source to go to. If we can show, there it is. It is kycovid19.ky.gov. It will update our numbers, and it has the guidance that we're adding almost daily. Just about every call I have with different groups, which we're doing all day long to make sure that people have the information they need, is ultimately posted on this website. The reason that we have a website and not a whole lot of different things out there is we want to drive everybody to one definitive source, and that is kycovid19.ky.gov. I issued an executive order to prohibit price gouging. Those that believe they see price gouging should call the Office of the Attorney General at 888-432-9257. We are asking businesses to adjust their sick leave policies to be paid to make sure that there is no incentive to come back to work when you're sick, and we're doing the same thing in the state. We are publishing the CDC guidelines with warnings that do change over time, but it especially identifies individuals over 60 and those with heart, lung, and kidney disease, compromised immune systems, diabetics as some of the most vulnerable that need to take extra precautions. We have recommended social distancing for all Kentuckians, and that means trying to avoid crowds. Now, social distancing, trying to be 6 feet apart, practicing good hygiene is not the same as isolation. And I'm going to continue to say this because now as we work in this mitigation phase, we got to look out for the mental and physical health of Kentuckians. You can still have a good conversation 6 feet apart, show emotion, enjoy the interaction that we do with our fellow human being in that 6-foot radius. And while we want you to avoid crowds, that doesn't mean you can't get outside with your kids, that you can't do things that help your mental and physical health over these next couple weeks. We need you to limit your contacts through social distancing, but that does not mean that you board yourself up inside your home. Folks, we want you to come out of this healthy. We want to come out of this strong, and just let's make sure that we limit our contacts, but we do what's necessary to take care of ourselves. I've also issued an executive order waiving copays, deductibles, cost sharing, and diagnostic test fees for private insurance, and we continue to work to loosen or eliminate any impediment that would exist in Medicaid for addressing the coronavirus. We're working with all 120 county judges through the Emergency Management Network. We have restricted visitation and strongly recommended eliminating visitation in long-term care facilities and nursing homes, except in end-of-life circumstances. We signed an executive order allowing pharmacies to refill prescriptions up to 30 days. That's important right now if you can't get back to your doctor. And it also will allow us to stage pharmacies if necessary. We asked Kentucky's public schools and private schools to close for at least the next 2 weeks. I am informed that as of about 4 o'clock today, all 172 school districts, the Kentucky School for the Blind and the Kentucky School for the Deaf, and 53 area technology centers are closing for at least 2 weeks. All but 4 are closing on Monday, and the remaining 4 are closing on Tuesday. I can't thank those folks enough. This is the most effective if everybody does their part. We appreciate people taking this aggressive but ultimately necessary step, and you look around the country and you see other school districts doing the same. We closed all of our state prisons to visitors, necessary to protect that population as well as the corrections officers. We've advised all community gatherings should be canceled or postponed, anything that you can do virtually, over the phone, through radio, we're asking people to do that. We're suspending out-of-state travel, non-essential travel to state employees. We have instituted more aggressive telework policies even today throughout our cabinets here in state government. And we've recommended the temporary closure of senior centers to halt the spread of the virus for the most vulnerable. We've announced effective immediately that KEME will provide wage replacement benefits for first responders and medical personnel who have been quarantined for the virus, who are at increased risk. And we've announced boards and commissions will cancel any scheduled in-person meeting and instead use video teleconference technology. Boards and commissions will provide the public with a link to access the meeting remotely. Last piece of news that I have is, we announced that the 16 Grand Princess Kentuckians were coming home. There have been a number of snags in that. They are at 2 separate Air Force bases. We want them back. We are willing to take every step that's related to the virus. We are willing to do any and all testing. We are willing to do any type of quarantine or self-isolation. These folks have been gone for far too long. Our compassion tells us that they should be home, and we will do everything that is medically necessary to ensure that we can keep them well and keep anybody from other exposure. But those people have been gone from their home state and their home for far too long. I've begun putting in calls to do everything we can to get them back. With that, I think we will open it up to questions, and in the midst of some questions, I'm going to read a couple and respond. Chris.
Can you clarify the number? I got a text from somebody asking, is that 1 from the state lab, 3 from U of L, 1 from Montgomery County, meaning 5 new cases today?
We do not know whether the all 3 U of L are new or whether some of them have been previously reported, and that's because of the way that the data is coming in. From the state lab, we have 1 new positive. From Montgomery County, we have 1 new positive. And looking at U of L's data, we at least have to have 1 new positive from that. So I believe tonight we have at least 3 positive cases. We could have up 3 new positive cases. We could have up to 5. I don't believe that's going to be the case. It's going to be between 3 and 5. But with all these different labs doing it now, that's just going to be a little bit of what we have to deal with. Our goal from here on out is to try to report numbers as we have them at 4 p.m. each day with a cutoff at 3, and where we will provide the best information we have coming in from all these different labs. But again, this is something entirely new for this country and for this state, and we're doing the best we can to compile all the information coming from different places.
Governor, there's additional cases from Franklin County. Why can't you say what county the additional cases from?
There's actually some confusion about where it's from, and I don't want to give you incorrect information. The moment that we can confirm that, we'll put it out on social media. With what this virus is, we ought to expect that it will be in every region, but I don't want to give someone the wrong impression. Let me read one. The governor has advised all business to have employees work from home. When will he make suggestions on state government, area development districts, et cetera? We have now put out guidance where we are trying to be very aggressive in telework in state government, trying to ensure that we thin out the number of people that we have in our physical buildings and that we have more people working from home. We also want people to be able to self-report if they fall within the more concerning categories, the more vulnerable, so that we can make sure that we provide an even more flexible schedule for them. There's obviously a lot of employment law that is out there, and so those that are coming to us that are concerned they're specifically vulnerable, we are working on longer-term plans for.
How does the declaration of a national emergency impact Kentucky?
Well, we know that the national emergency is going to loosen some restrictions. And so we believe that those are going to be helpful. We're still reviewing, because this, I believe, the press conference may still be going on. It was going on, at least as of about 30 minutes ago. We're still reviewing exactly what it will mean. Now, the press conference did talk about a lot of drive-through testing. They were talking about areas that have different capabilities than we do right now. I want every Kentuckian in the future to be able to have the ability to get a test if they want one. But I do want to advise people that we are not there yet. We don't have the technology infrastructure that a couple of these other places have to run hundreds or thousands of tests at a time, and we are waiting on the national labs in getting to that point. I want to make sure that what we're dealing with every day is the right here and the right now of our situation on the ground. And I believe that we have a system in place where those that are the sickest, that truly need that test, get it. And it's important on us that if we are well, right now we are not pushing for that test that I hope we can have later, but to make sure we're caring about others. All right, one of our other reporters who's at home says, has any patient in Kentucky died that was previously denied a coronavirus test requested by their doctor of the state? To our knowledge, the answer is no, that we have not had any of those situations. We had a question here about the national emergency and how it would affect Medicaid. I think we are still evaluating that as early as it is. We'll try to provide comments on that tomorrow. What is the state doing for those who become unemployed or laid off due to the coronavirus? We are working on this right now. Some other states have taken some steps. We want to take some steps to make sure that people can get their unemployment more quickly. And I hope that we would have news even early next week on that. Reaction to the president's state of emergency. State of emergency overall has to be helpful. It has to mean that we're going to have some more flexibility, and I certainly hope it means we will get more funding. We just need to determine exactly what that means to be able to provide everybody with responsible information. So what we have tonight are some more positive tests. Again, we expected them. We do have a lot of negative tests, and for everyone whose test was in this batch, we are happy for them. But again, we are expecting more positives. We're expecting more positives each and every day, but that is why we're taking the steps that we are taking to better protect Kentuckians.
Do you have the demographic on the Jefferson County case we've been talking about that may be connected to Humana? Were you able to confirm that this afternoon?
We're not able to confirm right now which of these three line up with any individual case. That's, again, one of the challenges of what's coming in, but we'll try to have that information for tomorrow. If Humana's confirmed it and U of L has confirmed it, then there's no reason for us to believe that it's not accurate. We are treating those positives that we haven't been able to confirm as positives until there's some reason to believe they're not. We believe it's the more responsible thing to do.
Governor, it's the weekend. People like to go out to eat. They like to go to the movie theater, the bowling alley, roller skating rings, whatever, where there are usually a lot of people. What's your advice, recommendation for those kinds of activities?
Our advice is you need to avoid crowds. Now, does that mean you can go to a restaurant as long as people are spread out? We're going to be putting up guidance for food service and that here soon. But again, you need to practice good judgment. If you're going to a place and you see a large crowd with people very close together, not 6 feet apart, that's not what we should be doing. And so we need everybody to take that responsibility, being a part of Team Kentucky. Like I talked about this morning, don't be Rudy Gobert. What happens is that Donovan Mitchell tests positive afterwards. We all have a duty to protect each other like they are our teammates in this battle that we are in against the coronavirus. Listen, I know we're going to win. I just want to make sure that we protect as many of our people and as possible and all of our people as we get through it. But do things this weekend. I'm going to go out and if Will's finger, my son, he broke a finger recently, can handle it, we're going to shoot horse. My daughter's going to ride her bike. We're going to take the dogs for a walk. All things that we can do with the right social distance around us. And we're going to spend as much time as we can together as a family. We're also going to look for opportunities to help others that have extra needs. We are very concerned about both our kids and our seniors and their meal service. And we're going to continue as a state, and I know localities, to do everything we can to make sure we can provide those same number of meals. We're going to make sure, and my family, that we do things to help out with that. I've seen that others are chipping in, and the great part about Kentuckians is that we band together. to make sure we protect each other. Remember, if you've got homebound seniors, we have to continue to check on them. We can't let our fear keep us from compassion, and fear, if it gets out of control, can cause more harm than this virus ever will. Just make sure you practice good hygiene, and one of the ways that you can do that is you ought to treat yourself like you have the virus in dealing with those that are most vulnerable, so that we can make sure that it doesn't spread. Remember, everybody, you've got two duties. Number one, to do everything you can to protect yourself and your family from getting the coronavirus. But number two, with 80% of folks having little to no symptoms, you got to do everything that you can not to spread it to others, given that you might not even know that you have it. Any final questions?
Have any of these patients been in critical condition at any point? Do you know? And I ask this because if you go to social media at all, you see a lot of people frustrated with the school closings and the other closings and concerned about layoffs happening, and they don't see the seriousness of this yet, and they question whether it's overkill.
Well, I would steer them to Seattle and the number of deaths that we have seen in senior centers, knowing that we have more grandparents taking care of grandkids per capita than any other state in the country, that while we believe kids are generally okay and not harmed by this virus, that we believe they can spread it. And kids in school are always closer than 6 feet, and as we know, they spread everything else. Going home to grandmother and granddad, and we're so happy those grandparents have stepped up to take care of them, is just a real significant risk. And let's face it, in Kentucky, we are in the tops in the country in heart disease, lung cancer, and diabetes. I know these are steps we need to take, and if you look around the country, others are taking them too. But at the end of the day, my job is not to please folks that think we may be doing too much. It's to save lives. And what we're doing right now is an attempt to save lives, and I believe it's going to work. Yes.
The ACLU has asked that those who are incarcerated, because they can't pay cash bond, be released at this time. How would you respond to that?
That's the first time I've seen that. I'd like to look at that request. I know those in our prison system, and we control prisons as opposed to jails, where most of those awaiting hearings are getting extra calls. We fully understand how difficult it is for prisoners not to be able to interact with their family. It's maybe one of the most important things that they are able to do. And we want to provide everything we can. That free phone call and others, I believe we're doing it once a week right now, to try to keep those ties and bonds up. But let us look at that request.
Earlier this hour, we reported on your meeting today with House and Senate leadership. What did you learn from that, and what do you anticipate is going to happen next with the General Assembly maybe coming back on Tuesday?
Well, we had a widespread, an exchange of ideas. I think that they are thinking through a number of options. I want to give them the space to come to any conclusions that they have, but they're thinking through this challenge that we're dealing with as well, and how it would impact the session. I believe there's a number of different thoughts, everybody trying to do the right thing, and we'll be in contact again over the weekend.
We've asked them whether it's going to impact how many days they have left, but will it, and they want to preserve their veto power, will this impact, have you talked to them about bills that maybe you'd be more likely to veto than others, or have you negotiated any of that to try to speed up actually getting work done with the few days remaining?
They haven't asked me that yet, because there would be a 10-day period where they're gone during that. But I've told them I'm willing to work with them. I've told them on regular bills that if we're going to veto them, we can do it more quickly, and they can have any reaction to it more quickly. There's no question that the fewer days that the session can be compacted in would be better from a health standpoint. We have to have a budget. We do not know when we're going to get to the other side of this virus, and if it were to extend beyond the current fiscal year, that would be very problematic. The other thing that we don't know is how much that it will escalate, and if we'd be in a position where I would not be in a responsible position for calling them back. So I believe the most important thing we need is in pretty short order for that budget to be passed in some form. Okay. Thank you all very much. We will be back here at 4 p.m. on Saturday. I know I've said this, but to everybody out there who's watching and everybody's here, take care of yourself. I know we've all been working really hard. Make sure you're getting sleep, staying well. It's important that we can get the news out, but it's also important that you all stay healthy for your families. Thank you.
Thank you.
See you tomorrow.
Bye, guys.